Hello, this is Dr. Judson Brandeis coming to you from BrandeisMD. The discovery of Viagra was a tremendous step forward in the treatment of erectile dysfunction. However, many men who take Viagra do not experience any benefit. Those who do take Viagra often find side effects such as headache, nausea, vomiting, or other more serious health concerns that limit use. What's the best next step for these individuals? Today we're going to talk about one exciting new option for the treatment of ED called PT141 or bremelanotide. PT141 is a peptide that works on a completely different pathway than Viagra to increase libido and erectile function. In a recent study, it was found that PT141 in combination with visual stimulation produced an erection in 30 to 60 minutes in men with moderate erectile dysfunction. Side effects are rare. The most common to occur is nausea. No significant changes to blood pressure, heart rate, or EKG were seen. PT141 was initially investigated as a sunless tanning agent. Clinical testing in women resulted in an unexpected side effect: increased sexual arousal following shortly after administration of PT141. Clinical research into the aphrodisiac properties of PT141 has recently led to the FDA approval of PT141 in the treatment of hypoactive sexual desire disorder in women. It was renamed Vyleesi. So how exactly does PT141 work? PT141 is a stimulator of the melanocortin-2 pathway in the brain. These neurons were identified as having a direct stimulatory pathway to the penis. PT141 binds to two specific receptors in the brain, the MC3 and MC4 receptors mainly located in the hypothalamus, triggering an erectile response. PT141 activates the melanocortin pathway in the hypothalamus, which is linked to the nerves going to the penis, resulting in an erectogenic response. You might be wondering, what does all this mean? Well, sexual behaviors stimulate peptides and neurotransmitters in the brain to communicate with the spinal cord and finally to the sexual organs. Neuronal nitric oxide facilitates the erection-inducing signal. Endothelial nitric oxide is still the primary signaling mechanism in penile erections. You might be wondering if you build tolerance to repeated doses, but repeated doses have been shown to continue producing spontaneous erections without needing higher doses, so men do not build tolerance to PT141. But repeated doses can reduce time to the first erection. PT141 is given through a subcutaneous injection, which has the benefit of a rapid onset of action without side effects such as requiring a higher dose of medication. It's also been shown to reduce the onset time to effect. Is PT141 right for you? PT141 can be used alone or in combination with treatments from other pathways like Viagra and Cialis. It requires a single subcutaneous injection into the abdomen or leg. There's no need to inject directly into the penis like with Trimix. The expected onset of action is about 60 minutes, and erectile enhancement will last for hours. The libido boost can last for days. So a standard dose of PT141 on Friday will boost libido throughout the weekend. The known side effects of PT141 include flushing, drowsiness, nausea, headache, flushing, and increased blood pressure, although most of them are pretty uncommon. The most common side effect is nausea, which can be managed with over-the-counter medications like Peptide or Zofran. PT141 works in many men who can't use PDE5 inhibitors like Viagra and Cialis, which give them side effects like nausea or headache, or they're taking sublingual nitroglycerin because of their heart disease and can't use PDE5 inhibitors. PT141 modulates neuronal activity and can be taken in some cases where other medications cannot. 80% of the time, in non-responders to Viagra, they'll get some response to PT141. So where can you get PT141? There are a number of online manufacturers which are mostly overseas and lack documentation or rigorous testing. It is well known that there can be hidden poisons in counterfeit medications. PT141 is a safe and effective treatment for men seeking improvement in erectile function and libido from a single injection into the fatty tissue. If you're interested, please call or email BrandeisMD in San Ramon, California for a free test dose.